So I read these commissions, and why isn't there more of a business plan in these commissions? Why isn't there more, if we spend money here, we'll see double savings here? I mean, there's code words, like you said, flexibility, and under the education section. This means that we spend more funding here, but flexibility to me just means flexibility.
Right.
So why aren't these more of a business plan? Laura Snyder would be able to understand that if we spend money here, we save money here.
So I think there's a couple of things. I think first, you have to remember that this is a public document. That this report is it's available on the state's website. It was given to all the participants that came to our work group meetings and came to the public hearings, and to truly respect the citizens whose lives are going to be touched by this, whether they're the patients and clients, whether they're the healthcare providers, whether they're the family members. It can't all be about dollars and cents, right? Like, it's not respectful to them. And what is in this report for the public consumption it's high level too. It's there, you got bullet points. You don't really have, and in our work, we do a lot in shared documents. We do a lot on Google Documents. I can tell you, we've got spreadsheets and spreadsheets and spreadsheets of dollars and cents. We know exactly how much money is being spent in every different sort of silo here. Even the transportation piece that I talked about, what we were able to put together really briefly is there's a tremendous tens of millions of dollars of state money that's going into transportation in the state, but again, in very siloed ways through DHS, through DCH. So is there the sort of the back end, all the financials, all the business plan, the studies that show where the savings are, the idea in here of doing a pilot on bundled payments, which there's really not very many states yet in the nation that are doing a bundled payment option. So you sort of have a contract that you send out to an RFP to providers who will say, okay, I will take care of this population for this amount of money, and I'll take care of all of their care. And if we save you money, then we keep the savings, right? So it's a way to encourage them to keep to that savings. There's nobody doing it in behavioral health right now, really, anywhere in the nation. We want to be the first to try it and see if we can't make a difference, especially for some of our high need young people. So it all exists. Just remembering, I guess, what the purpose of this document is. Yeah.
Are there, to piggyback off this question, are there any tax dollars that's being used in any of you guys' efforts or funding at all for this?
So I want to make sure I understand the question right. In our efforts as a commission, as meeting and staffing and that kind of stuff, or in these recommendations, implementing these recommendations?
And implementing the recommendations.
100% tax dollars. This is all state money. This is all, or it's us state money and federal money coming together. In a couple of places, I think that we'll be able to leverage some private foundation money, because we've seen that already, especially in the telepsychiatry project I was talking to you about. But this is 100% the citizens' money. Absolutely. Yeah.
And I was asking that because you said it was behind the scenes, and the people's right. I know the people's privacy, but also the people's right to know where their money is going. Right.
And there's no. I guess I just want to be clear. There's nothing about our work that's hidden. It's all public. We're a public commission. All of our meetings are public. All the stuff that we talk about. It's just us trying to address the question of why didn't in this document you put all that information, and to me it really wasn't the purpose of the document. So all that stuff exists. Anyone can have it, and you can right now. You can on the state's website and through just simple requests, you could find out if you have an interest in a particular program. How much is the total community health budget? How much is going to our CMHs in our local communities? All of that is completely public and not hidden in any way.
Can I ask you,
Sure.
You talked about the school-based community health
Yeah.
centers and focusing on success, and that's moving forward, and
Yeah.
a lot of the details. Can you talk a little bit more about the decision-making process? How are schools being chosen? How many more can we anticipate? How's that going?
So what we wanted to do for the next round of expansion is we want to put two criteria together, a place where we know is already considered medically underserved and where the highest need is for services. So we'll look at those two criteria. And right now we're in the budget, we're in the middle of our budget conversation. So we had one meeting already. Like I said, we've got this pot of money that's allocated, and now we're everything in here had a unanimous recommendation, but now we're tussling amongst each other to see how much each of our recommendations end up getting and how much certain things cost. So I don't know how many more we'll be able to add this year, but that's where we will prioritize, or those areas that are already underserved, medically underserved, and where we know we have a high need. And we'll see. I mean, it will literally be in the next couple of weeks, because we're in the heart of the budget process right now in the state, and so we'll finalize our recommendations. The commission meets again next Tuesday, and we'll continue to work through the, not every single one of these recommendations needs money. Some of them are things that we can do inside the department with resources that we already have. So some of this work doesn't, some of those we go through quickly, and then others we, again, we have to negotiate amongst ourselves. And you've got somebody like me who's the left of the left who would argue, well, the governor gave us this pot of money, but if we go lobby our colleagues on appropriations, maybe we can get even more, like why set ourselves at that ceiling? Let's go, we'll get more for the programs we care about, and you might see us doing that still, or at least me.